Hi there, this is Jürgen Rasmussen speaking. I am honored to be speaking at the UK Hypnosis Convention 2018, and I thought I'd take some time to invite you to my presentation. My presentation is a psychological illusion approach to resolving trauma. So, my take, if you attended my seminar last year at the UK Hypnosis Convention, you saw that my approach to hypnosis and change work is a psychological illusion model approach, meaning specifically that I view what most people call mental illness or psychological issues as people falling for some very simple psychological illusions and misunderstandings. And that my job, given that it's a psychological illusion, I don't view what I do as treatment or therapy or curing. If you're dealing with a illusion, there's nothing to cure, there's nothing to treat, there's nothing to work with per se. It's more about having a embodied realization or understanding so that you can see through the illusion. Now, in my experience, I've spent about 21 years now seeing clients full time. I've done a lot of work with people who have traumatic memories, and trauma sucks. That's just the truth of it. I spent probably a decade as a hardcore hypnotic regression artist combined with NLP skills. I've also spent a lot of time approaching these types of issues from a more rational emotive behavior therapy perspective, the work of Albert Ellis. Um, in the last few years, I have more and more adopted this psychological illusion model and found it, in my experience, to be a much easier, faster, benign way of working with traumatic memories for most people. So, people who suffer with trauma are falling for the illusion that there's a perception of inescapability. That's that's one illusion. So if you can give them a embodied experience where they see through that illusion, the trauma has a tendency to collapse like a house of cards. Um, Trauma also has to do with, or I should say, the fact that most people so severely misunderstand memory and how memory works also contributes to people being unnecessarily traumatized. And there's also a identification issue, meaning that when we say that I am traumatized, there's a psychological illusion at play there that we can see through and which has a tendency to dramatically shift our experience. So when I say psychological illusion, I'm referring to the notion that when you first experience something or you first see something, it might appear in a certain way. It might appear traumatic. But since what you think you're experiencing is not really what you're experiencing, that means that if you know how to take a look and to really look at it in a focused way, you have the opportunity to discover that what you thought was there is actually not there. So during this particular seminar, I'm going to be doing some live work, some live change work on stage. There's going to be demos, and I'm going to present to you something that I'm very sure is different from what you're currently doing. Won't necessarily replace what you're currently doing. You can still do all the stuff that still works for you, but it's very likely that it's going to be different. Something else as a little bonus. I used to do trauma work very directly. And over the last few years, I've discovered that it's possible very often with a lot of people to do the work more or less completely indirectly without even directly touching the memories or uh, having the person go through very much discomfort whatsoever. So if this appeals to you, if I've kind of piqued your curiosity a little bit, then I hope to see you at the UK Hypnosis Convention 2018. So hope to see you there.